Welcome, friends. Today we will explore Ujjayi breath with internal retention, Antar Kumbhaka, which means holding the breath in. So please go very slow with this practice. We will try to make this retention a little bit longer in the future. And during this video also we will try to starting with a very few seconds and improving the length. If you feel out of air, please relax. If you have any blood pressure problems or heart problems, or in the past you had strokes or any other heart condition, please be very careful or just skip these practices or consult your doctor before attempting to hold your breath. So let's start. We will apply Ujjayi breath and we will apply Jalandhara Bandha, the chin lock. As we've seen in the other videos, constriction of the throat, slight constriction, like fogging the glasses, and bringing the chin towards the chest and the chest towards the chin. So you find your intensity in both these techniques. You can either be here or you can be just here with the chin lock, and your constriction can sound like very mild or also can sound like, but only do this if you are really experienced, if you have tried the Ujjayi breath many times before. So let's start. Once again, we will wrap Akasha Mudra. So middle finger and thumb, fingertips touching, chest forward, shoulder rolled backward, nice little arch in your lower spine, just the natural arch of your spine, and floating ribs forward, back straight, top of the head above your hips. Close your eyes gently, relax the sides of your head, the skin of the temples, and wrap the mudra and the chin lock. And now let's start with a few rounds of inhale and exhale in Ujjayi. Relaxing the muscles of the throat and the neck. We don't want any tension. Be sure that we are not leaning forward. And now exhale completely, Ujjayi. Slow, full inhale. Fill up your lower lungs, middle of the lungs, upper lungs and chest. And then hold your breath. 1, 2, 3, 4, 5. Slowly exhale with the Ujjayi, controlled. Inhale normally. A few more rounds of natural Ujjayi breath without retention. And once again, exhale completely. Pushing your abdomen in. Inhale fully. And hold. Close the chin lock. 1, 2, 3, 4, 5, 6, 7. And slowly exhale. Inhale. Exhale completely. Big inhale and prepare for another round of retention. Hold the breath and focus your attention on the inside of the body, on the sensation that you feel, on the movement of energy inside your body, the circulation of the blood, the oxygenation of the blood. Keep your breath in and exhale. So if this is easy for you, you can follow my instruction and we will elongate the retentions. Otherwise, keep a comfortable pace. Maybe take one breath of reset and then one retention, internal retention of your perfect duration at the moment. It can be 5 seconds, it can be 10 seconds. Count for yourself and see. But what is important is that we focus on the feelings and the sensations of the retention and not on the effort of holding the breath. So for now, we just do what our body allows us to do. Exhale completely. Inhale. Lock and hold. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Exhale slowly. One breath of reset. So when you take your big inhale before holding the breath, you can try different things. You can try to make it completely full, so fill your lungs to the rim, or you can try to leave some space. This will change the pressure in your lungs, and it might be easier for you to hold the breath without tension. So you can try. It's important to explore on your own and see what works for you. They're all different and at different stages of breath control and awareness of the lung. Once again, exhale completely. Inhale, just as much as you need. Hold. And just hold. I will not count this time. Focus inside, don't focus on the number. And when you feel the urge of breathing in, maybe wait 1 or 2 more seconds to extend your comfort zone a little, and then take your normal slow breath out. So if you feel that when you breathe out, the breath is not coming easy and fluid, it means that you hold for too long. So reduce the length. So now I will allow you to explore. Take one breath of reset between one retention and the other. Keep the attention on the inside of the body. Keep the attention on the fingers touching in the Akasha Mudra. And if you feel that the lock of the chin is troubling you, release it and keep your head straight, maybe just slightly forward to keep your spine straight. Or otherwise, if you find it comfortable, you can add the Mula Bandha, which we have already explained. So that little pool of your perineal area, your pelvic floor, So in retention, when you are holding the breath, you can keep your chin locked and also pull the perineal area, the pelvic floor, slightly gently, and feel the sensation, how it feels. And then before you inhale, you release. Maybe you can release both bandhas, so also the chin lock. And exhale and push out your pelvic floor. When you exhale, if you had applied the constriction of the pelvic floor, pull it and push it when you release it, so that you give it a little bit more relaxation. The muscles of your pelvic floor are very important, especially for women, but not just for women. We want to take good care, but we also want to strengthen them. So continue with your Ujjayi inhales and exhales. And every 1 or 2 breaths, apply your retentions without forcing, without stressing, without straining. Our first introduction with the effects of internal retention, Antar Kumbhaka. The oxygen has more time to get absorbed efficiently in the blood by the cells. Oh, the blood feels nice, oxygenated. And continue like this for 5 or 6 more minutes, experimenting with the different bandhas, the Mula bandha, the constriction, the contraction of the pelvic floor, the chin lock, the Jalandhara bandha, and different lengths of retention, different intensity of breath. Once you have found something that works for you, keep it and maintain it regularly as a rhythm for a few more minutes, and then repeat this video a few more times so you can try this practice without the video as well. Very simple. Never force your holding. Just by being easy on yourself, you will slowly improve your holding capacity. 30 seconds, 40 seconds, 1 minute, you will see. The more pressure, the more you intensify your bandhas, the harder it will be to hold the breath. So the more you pull Mula bandha, the more you lock the chin in Jalandhara bandha, the more you fill up your lungs when you inhale, the more difficult will be the hold. So use as a measure of your success your ability to keep a relaxed and long exhale without jerks, without panting. And enjoy the sensation and the feelings in your body and the exploration of the practice. And continue until you hear the sound of the bell.